overall, the field of medical oncology, of surgical oncology, radiation oncology, all of these together, along with our colleagues in pathology and elsewhere, we really confront a broad array of diseases, plural. And we're understanding more and more about these diseases because of the remarkable advances that are being made in molecular biology. And as never before, we have the ability to develop novel, targeted, less toxic therapies that are really built upon our understanding of the molecular biology. So I'm excited about the broad field of oncology because of the way it promises to deliver better care through technology. For many, many years, many patients and investigators have been enthused by the possibility that we could control and manipulate our immune system to treat cancer. This has been a relatively elusive goal. We've had some antibody treatments for several years for a limited number of cancers, and more recently we've had the ability to use antibodies that are tagged with drugs or radioactive particles to treat cancers. In the last 12 to 24 months, we've begun to see a really meaningful advance in the use of broader immunotherapy to treat some historically challenging tumor types. Most notably, we've seen activity in metastatic, that means widespread, melanoma. Historically, this is a disease that's been hard to treat with, unfortunately, poor outcomes. And last year, we saw the first treatment, an antibody against a very specific receptor in the immune system called CTLA4. This year, at the annual ASCO meeting, we saw a real change in our thinking about this because we saw activity for a second independent target in the immune system, and we saw it from multiple institutions and multiple studies. And here at Memorial, Jed Wolchuk demonstrated that a unique combination of immunotherapies led to unprecedented response rates and seemingly prolonged survival in patients with metastatic melanoma. It represents a translational science success. Through our understanding of the inner workings of the immune system, we've been able to develop targeted treatments that are effective. The second thing is it represents the beginning of an achievement of a long-sought goal, productive manipulation of the immune system and patient benefit. And then the third thing, and that is that it may be that this provides a window of opportunity to broaden the immunotherapy approach beyond what has been its traditional target, melanoma and a few other difficult to treat diseases, into many of the more common cancers that we treat, like breast cancer and others. And indeed, we have ongoing research here at Memorial right now testing immune manipulation in a variety of tumor types, including in very early stage breast cancer.